Hello, in this video I am going to discuss with you about smoking. Next slide. I am going to talk about the prevalence of smoking in Jordan, components of a cigarette, smoking hazard, and benefits of quitting smoking. Next slide. First of all, prevalence of smoking in Jordan according to the World Health Organization. The percentage of female smokers ages 15 and up is 10.7%, and the percentage of male smokers ages 15 and up is 17.2%. Next slide. Now, what is a cigarette? A cigarette is a cylindrical roll of shredded or ground tobacco that is wrapped in paper. Tobacco contains more than 7,000 toxic chemicals, with more than 70 of these substances carcinogenic. Next slide. This figure clarifies some components of cigarette. Butane is leather fluid. Cadmium it is used in batteries. Acetic acid it is used in finger. Methane it is a sewer gas. Methanol it is used in rocket fuel. Arsenic it is a poison. Nicotine it is used in insecticide. Toluene it is industry solvent. Hexamine it is used in barbecue leather. Citric acid it is used in candle wax. All of these components are harmful to our body. Smoker person not only harm himself, but also affect all other person present when he is smoking and they are considered as a smoker person. Next slide. This figure describes the smoking hazard in our body. Smoking considered the first cause of lung cancer. Also it causes mouth cancer, throat cancer, kidney and bladder cancer, cervix, ovary and uterus cancer, and stomach cancer. Skin of smoker person become wrinkled. Smoking person is susceptible to brain, stroke, heart disease, asthma, infertility, stomach ulcer, and person with diabetes complication may be developed. Next slide. Now, this video will show the difference between a healthy lung and the lung of a smoker person. Pay attention to the color of the trachea and look how the lungs are discolored. Finally, I will talk about the benefits of quitting smoking. After 20 minutes, blood pressure and heart rate return to normal. After 12 hours, disposal of toxic CO from the body. After 2 days, taste and smell start to improve. After 2 weeks to 3 months, blood circulation is activated. Next slide. After 1 to 9 months, the lungs begin to get rid of a phlegm, and coughing, shortness of breath, and wheezing decrease. After 1 year, your risk for developing coronary artery disease is half that of a smoker. After 5 years, your risk of oral, esophageal, and bladder cancer are reduced by half. Next slide. For all smoker person, remember that it is never too late to quit smoking. Next slide. Save your life and quit now. Next slide. These are references you use in this presentation. Next slide. This presentation is prepared by Naima Abdullah, Heba Alkouz, Amani Zakaria, Dania Sabba. We watch that all of you have a healthy life without smoking and without other disease. Thank you for your listening to us.